I just want to say it's great to be here to see and reconnect with so many friends. I was in Worcester County for the past several years and have spent the last year with Gillis Gilkerson. I don't get to see many of you as often as I did, but it sure is great to see you today, so it's good to be here. Today, I am honored to introduce to you Steve Leonard. Steve is the President and Chief Executive Officer of Peninsula Regional Health System and Medical Center. And today he's going to be talking to us about the acute care and population health on the shore. Welcome, Steve.
Great, thank you for having me. It's a privilege and an honor to be here representing the 3,000 folks in our health system who quite honestly do amazing things for our community each and every day when folks who are incredibly in need. From a business perspective, it's also a pleasure to be here. I remember I too, like many folks in this room, are SU alumni in one form or another. I did my MBA here. I taught here for a while, and it was a great experience. I remember in my MBA doing work and research around the effects of healthcare expense on the international competitiveness of certain organizations as compared to other countries. And much like we all believe education is an investment, we also look at healthcare and what that does from a business perspective is crucially important as well. So my goal today is to quickly kind of share where PRMC is going from a healthcare perspective, and hopefully in the long run help businesses by improving health and wellness and reducing the cost of care. For most folks, I think people understand, but often I'm surprised even in orientation when I describe the vast array of services that PRMC is offering these days. For the salmon area, that represents our traditional primary service area where we have a number of different basic services related to primary care, and that's where most of our patients come from. But the yellow area, most folks might not realize that because we're an open heart regional trauma center, we get referrals from multiple outlying facilities. And I think folks in this immediate community often underestimate the fact that, you know, we are practically as large as the folks you sometimes see across the bridge, and we have an incredible array of services. So like education for where you want to live, I can also tell you where you want to retire, folks are looking for healthcare systems like this. What's amazing on this graph is that it's about 500,000 people that live in the I guess is that salmon and yellow. And you know who that doesn't include? Our 300,000 friends from the Western Shore who come and visit us every day in the summer and often decide to do things, perhaps have heart attacks, strokes, sometimes have their babies here, but we're here to take care of them. So my new tagline, quite frankly, is PRMC takes care of the entire state, especially in the summertime. From a hospital perspective, I think most folks know this symbol. It's a hospital. You come to us when you're sick or injured, but really times are changing. They're changing quite drastically. We've got about 120 years of experience taking care of folks when they're sick or injured, but our new world is all about keeping people healthy and well and out of the hospital. It's been going on for about the last 5 years, and we're trying to get better and better at it. I'm going to talk a little bit about what you need to do that. First thing is you need to have a great organization from a scale perspective. What we're really attempting to do throughout that entire region is improve health and wellness. From a medical center perspective, we are the 8th largest in the state. We do about $500,000 in revenue, direct revenue a year. There's about 3,000 folks full-time on the team. Another 300 physicians, another 300 nurse practitioners, physician assistants, and so on. So to do this well, you really need, we have a great foundation. That foundation is often some of the things you see in town. We have an incredible tradition that goes back 121 years. Dr. George Todd started the hospital. His grandson, Dr. Nevins Todd, started the Open Heart Program, and in many ways it was these visionary physician leaders who really set us up for some incredible quality that we're able to provide here on the Eastern Shore. The one I'm actually really proud of most recently is that leapfrog. That was a little bit of a surprise to us. It wasn't so much the focus of Maryland hospitals, but that leapfrog group, if you're familiar with it, it was started by employers attempting to identify high-performing hospitals so that they could refer their employees there, all around patient safety, and we were one of a handful of hospitals in Maryland that received an A rating recently. What we noticed over the last several years, though, is it's hard for people to come to the hospital. Salisbury, it's obviously in the middle of the shore, but it still takes some time to get there. So we started making more ambulatory investments. So that's why you see us focusing on projects like Ocean Pines, a number of the outlying areas, so that people can have healthcare close to home. Our number one goal these days is to get people hooked up with a quality relationship with a primary care doctor. That is probably one of the best things that we can do as a system, is to find more primary care doctors and bring them here to the shore so people can have that positive relationship. I would also say, though, it's just not about primary care, and it's just not about a hospital. What we've noticed over the last several years, and what we've been attempting to do, is partner more and more with folks to provide what I call the continuum of services out there. So again, when you're sick or injured, you come to the hospital. Well, how do we keep you healthy and well and prevent you from coming back? So these are a number of businesses that many folks might not realize that we either own or partly own on the healthcare continuum. They include things like a home care company, a nursing home company. We have surgery center companies. A couple of the ones we're really recently excited about is we are now partners with Your Docs In. We have about 90,000 patients that come to the ER in Salisbury a year. 90,000. Guess how many probably don't need to come to the ER? Half. A third to half. So again, primary goal is to get them a good relationship with a primary care doctor. If we can't quite get that, I'd rather have them go to an urgent care center for the low acuity stuff. And that was one of the reasons we got into a partnership with YDI. One of the other ones that we just started up there is Core Life Delmarva. This is really exciting. We're probably going to have about 6 to 10 of these in the next couple of years. These are medically based weight loss centers where folks who are challenged with obesity can go to a very comfortable private environment, have a high quality relationship with a provider, nurse practitioner, exercise physiologist, nutritionist, therapist from a behavioral perspective, and really focus on weight loss. Because I think most folks would agree, if we're challenged with obesity, it tends to lead to a lot of other very bad things. So from a continuum perspective, we're looking, and we are in a number of other things to help us along the way to keep people healthy and well. From a collaborative perspective, I will tell you we can't do this alone. We look to partner with other facilities, both in our region and throughout the state of Maryland. One partnership that I'd highlight is with Health Visions Delmarva. It's up in, how many people have heard of Bay Health up in Dover and Milford? Great organization, very much like us. We have a very close relationship with them. Another partnership we're in is something called Advanced Healthcare Collaborative. We're partners with Adventist Hospital, LifeBridge Health, and Trivergent. All of these partnerships are really designed to help us get better at population health, keeping people healthy and well and out of the hospital. Again, where are we going? It is all about how do we take care of the populations. So how did we get here? It's been years the healthcare system has been evolving this way. And quite frankly, it's a challenge. If you look at healthcare consumption in this country, I looked it up this morning just to make sure, 17.8% of our GDP is going towards healthcare. So from a business perspective, think about what that does to, we understand what that does to all of the businesses, all of the folks in the community. Is that an investment or an expense? Donna's is a great investment. I probably could make the argument that if we're helping people get well and fixing them when they're injured, that's an expense. We need to pivot and start making more of an investment towards health and wellness. Organizations doing some pretty good things right now. For instance, when you come to the emergencies department, we have social workers 24 hours a day, really to help people with their particular needs, so perhaps they don't have to come back. We have bridge clinics, so once folks are discharged, they can go to a clinic, so they don't have to come back. We have community health workers out there. This is a whole new group of folks that are going into people's home to keep them healthy and well, which is a great thing. From a provider perspective, folks should understand that we're actually also working with many of the community providers to figure out how do we actually provide better medicine. In other words, I won't ask the question how many people go for their annual physicals, but not everyone does. What should that process look like? How should we keep people from progressing down a path of, you know what, you're heading towards diabetes, you're challenged with weight, your blood pressure's a little bit up. How do we handle chronic disease management? These are all things we're having conversations with, so hopefully we can avoid people actually going to the hospital. Out in the community, we're partnering with folks like the Wicomico County Fire Rescue in Salisbury. We partner, we have nurse practitioners that go out into people's home. So instead of calling 911 dozens of times through the year, maybe we can just take care of an issue in their home. How many people have seen our Wagner Wellness van?
in honor of the awesome Debbie Wagner. Again, going out to people's homes, their communities, and so forth. So there's quite a few things from a population health perspective that we're focused on. Health literacy is a big one that we're proud of with United Way and Beacon. There's my United Way friends. As Donna mentioned, we're all focused on education, but believe it or not, consumers sometimes have a hard time understanding healthcare providers. Big surprise. Our folks' understanding of what their discharge instructions are, their medication regimens, all of the things that are really required. That's why healthcare literacy is so important, and it creates tremendous waste in the system. So what we also realize, though, is that healthcare, ironically, the total expense of healthcare is not just about what we do. Believe it or not, there's genetics. Sometimes people are just dealt a rough hand. Is that a fair statement? And we have to help work through those things. Sometimes individual behavior has an influence. I make all kinds of choices. I would imagine people here make all kinds of choices. Some of that might not be in our best interest from a healthcare perspective. Some of it's social and environmental. Perhaps I didn't finish high school. I don't have a college degree. I can't afford to buy food that might be more appropriate than fast food. Sometimes I live in an area of the community where I might not have access to fresh food, whatever that might be. And those are things that we're realizing that ironically, out of 100% of healthcare expense, 10% is related to what we do in the hospital. All of that other stuff is 30, 40, 20% of the driving cost of healthcare. And those are the things that when we talk about our expense in the past of fixing people when they're broken or injured, we need to now make an investment in the future towards those things that can keep them healthy and well. And that's what we're looking forward to doing. So up until this point, I will tell you that we've had pretty good success, but we're not quite where we need to be, obviously. 121 years of fixing people in very difficult situation. The industry's only had, in the state of Maryland, about 5 years to actually start doing this work. Ironically, come January 1st, the state of Maryland enters a new phase of healthcare, where, believe it or not, our revenue at the hospital will be impacted, small at first, growing over time, by all of the other expenses from a healthcare perspective. So if costs rise in the state of Maryland, guess where they look to take some of the money away from? Where's our elected officials? They're very supportive of our concerns in this area. But really, is that a bad thing? Maybe not. What's our mission is to improve the health of the communities we serve. I can't think of a better alignment, quite honestly, to say, you know what, if you do it well, you'll do better, and then you can continue to reinvest. So I think it's an investment worth it in the long run. I do want to thank everyone in allowing us to share a little bit about where we've been for 121 years and where we're going into the future. So thank you for having us.